all about blood. Welcome to my channel. Today we are going to learn about red blood cells. Last video we learned about anatomy and functions of red blood cell. Now we are going to see about conditions and disorders of red blood cells. Before that we must know about the normal range of red blood cells in our blood. What is a normal red blood cell count? Normal red blood cell counts differ based on the individual. For men it will be 4.7 to 6.1 million red blood cells per microliter of blood. For women, 4.2 to 5.4 million red blood cells per microliter of blood. And for children, 4.0 to 5.5 million red blood cells per microliter of blood. Now, we knew the normal cell count of red blood cells. Next, what are the common conditions that affect red blood cells? Red blood cell conditions have either a low or high red blood cell count. Medical conditions that affect a low red blood cell count include anemia. It means your blood carries less oxygen than normal and causes your body to feel cold, tired, and weak. Second one is blood loss. Your body loses more blood cells than it can produce. Bone marrow disorder. You experience damage to your bone marrow, where red blood cells form, leukemia, lymphoma. And last one is cancer. Certain cancers and chemotherapy treatment for cancer can affect the number of red blood cells your body produces. Medical conditions that affect a high red blood cell count include polycythemia vera. It means high red blood cell count causes your blood to thicken, leading to heart attack or stroke. Congenital heart disease. One or more structures in your heart is irregular due to not forming completely during fetal development. Break time equals 1s/. Lung disease. The tissue in your lung scars due to emphysema, COPD, or pulmonary fibrosis. Next, let us see about the symptoms and causes of red blood cells. What are common symptoms of red blood cell conditions? Fatigue, muscle weakness, lack of energy, headache or dizziness, blurred vision, cold hands and feet. What causes a low red blood cell count? Causes that contribute to low red blood cell count include vitamin deficiency, iron, B9 and B12, malnutrition, pre-existing medical conditions or cancer treatment, chemotherapy. What causes a high red blood cell count? Causes that contribute to a high red blood cell count include smoking cigarettes, living at a high elevation, taking performance-enhancing drugs, anabolic steroids, dehydration, medical condition including heart or lung disease. What are common tests to check the health of my red blood cells? A complete blood count test examines how many blood cells are in your blood. A medical professional will sample your blood to count how many red blood cells are present. What are common treatments for red blood cell disorders? Treatment for red blood cell disorders varies based on the diagnosis and severity of the condition. Treatment ranges from taking vitamins, eating a well-balanced diet, treating existing medical conditions, getting a blood transfusion. Last but not least, you must know, how do you take care of red blood cells? You can maintain healthy red blood cells by eating a nutritious diet that is full of vitamins and minerals like iron, B9, folic acid, and B12, which includes red meat, beef, and meat from the organs, like liver, fish, leafy vegetables, like kale and spinach, lentils, beans, and peas, nuts and dried berries. See you all on next interesting lesson. Thank you for watching.